Patient Tim Smith was brought into the hospital presenting with inflammation dermatitis. A skin scraping test was ordered by the attending physician to determine Tim's diagnosis. The nurse takes the sample and checks and copies Tim's personal details onto the sample label and onto the lab requisition form. Because of this complicated flow of information, papers and labeling errors can easily be lost.
Hi guys, I'm Ravi and today I'm interviewing two health information analysts, Heidi and Kara. Come on in, guys.
Hi, it's nice to meet you.
Hello, I'm Heidi. So these two are here with me to talk about their new barcoding system that they've implemented at Conestoga Hospital. So guys, you were one of the first hospitals to implement a barcoding solution in a laboratory setting.
Yes, we began this project about 5 years ago, and due to the surge in our large patient number and our large samples that we were processing. So our renewed focus was on patient safety and getting the right specimen for the right patient, right time. We have already been using a laboratory information system, but there was no barcode solutions available or compatible with our laboratory information system, so eventually we decided to use internally develop our own barcode solution.
Okay, so why is a barcoding system something a hospital would even want?
Well, a facility like ours, very large, we have over 1 million slides. That's just for the histopathologists that are processed in our lab every year. So avoiding error due to misspelled or lost samples is a huge focus for us. Previously, tissue samples were received in the lab accompanied by patient details and physician instructions on handwritten labels. So all of our requisition, all of our container labels were all handwritten, which of course, we're human, we make mistakes very easily. So lab employees then had to enter the case details and urgency level into the laboratory information system, which again, more chances for error. If we had a barcode, we could just easily scan all of that in one simple shot. So by introducing a barcode system, we were able to label and track the specimen, so figure out who took it, when they took it, where they took it, and we eliminated the chance for cases of documented paper to be separated from the samples.
Okay, so how does the barcoding system change the way people are working?
Well, it increases time management, so they don't have to spend a lot of time thinking about where the unique code that they're going to be putting onto and rewriting it constantly.
Mm-hmm.
So barcoding systems allow patient specimen to be tracked efficiently and safely. We can easily trace who handled the specimen, like I said, who took it, where they took it from, what time they took it. By ensuring that each specimen has a barcode, our prosecutors had easy access to the information as soon as they scan and begin to work with the sample. Further along in the workflow process, histotechnologists are able to easily avoid missed message. Like I said, we have millions of slides that come in. So millions of slides, millions of chances to intervene and get mixed up. When dissecting a sample and moving between slides. Throughout the lab, we have a standard workflow that allows for maximum productivity and an easy solution for our employees.
Okay, so introducing a new system through an entire lab can be difficult. Did you meet any challenges along the way?
We did. So every detail really needs to be carefully analyzed. Even things that are seemingly obvious, like what information would be included on the barcode label, became really problematic. How could we fit everything we needed into a unique code on a wristband? So finding out what information to include was difficult. We also hired some additional consultants, but this added another layer of complexity. So for people to get support from the help desk, they had to wait because the consultants were busy in the beginning. So because of the delays with the implementation, the people who were working in the lab were getting frustrated. And the old system did work, so we really had to highlight the projected improvements and why it was important for them to use the system. But in the end result was definitely worth it.
So how can health informatics professionals help with this transition?
Well, our job as health informatics professionals is to augment the performance of healthcare professionals in their daily routines and improve patient care. So by implementing an adequate change management program, we made the switch to new technology easy and painless for everyone involved. Gathering feedback regularly and meeting in little subcommittees, including users in decision making, is very important to the success of a project.
Okay, so any advice for other hospitals, labs that are hoping to implement a barcode system?
Well, I would definitely say that all stakeholders and users should meet and feel confident in the solution. A positive attitude, a quick response to user feedback, and a willingness to change and move forward is crucial to the success of the project.
As you see here, we helped with the why. So that in Need for Success of the project, we had to let them know why we were doing this. Like Heidi said, our other system was still working. So we had to show that we want to decrease medical errors, decrease preventable deaths that were happening. So our goals was time management. So everything was still fast-paced. We could even make it faster than what it was by decreasing that handwritten requisitions that we were doing. We want to decrease patient error, which the barcode, the unique number, we can see the time, trace it, which we weren't able to do before. This all ends in the improvement of patient care, which if we make that available to anyone in the healthcare circle, administration, we can move from there and everyone can be on board.